Okay, we're talking about the HCG Express, trying to make it real short and sweet, how you can get the job done so that you don't have to have a whole bunch of varying opinions. I've got a ton of clinical experience with this. I've seen lots of patients who have done it. I've helped some patients with it who are appropriate for that. And I have seen people maintain weight loss the rest of their life, or at least 5 or 8 years since they did their protocol. The way that that's done is recognizing that this protocol that you're doing is a very aggressive hormone balancing period of time, 21 to 40 days. After that, you have a lifelong commitment to maintaining your weight within 2 to 5 pounds of where you left off. And you do that by limiting carbohydrates. Precisely sugar, cake, bread, pasta, rice, corn chips, all those things that they're very yummy, they create serotonin release, and they make you fat. So by limiting carbohydrates in the long term, you will get the benefit. It is not about limiting fats. You can eat fat, but you can't mix it with carbohydrate or you never feel full. And then you wind up back in that same boat where you're always hungry all the time and you continue to eat and eat and eat until your weight climbs back up. The reason people get heavy in the first place is because their eating patterns are off or their hormones are imbalanced. Either one. So if your hormones are balanced and your eating patterns are improved, you will maintain long-term weight loss. And of course you have to take vitamin X, which is exercise. We talked about intervals in another video. If you want to look at that, you can. Interval exercise and carbohydrate restriction. It sounds too easy to be true, but I've seen hundreds of people who've succeeded at this long term. At a 5-year period, 20% of people will maintain their weight loss. Every one of them has created their own program that it consists of, and always consists of, some exercise, some carbohydrate restriction, and a little bit of all the other diets. A little Jenny Craig, a little Weight Watchers, a little of this, a little of that. They're all good programs. Any program that you do consistently will help you to lose weight. The more you can learn, the better for you. Get with your doctor, make sure your hormones are balanced, because we're better together.